Hi everyone, I'm Melissa Mazzo from the Neurophysiology of Movement Lab, and I'm going to talk to you about some changes in neural drive to the calf muscles during studies of maximal contractions after repeated static stretches. So some of the most consistent results we see when static stretching the calf muscles are an increase in maximal dorsiflexion range of motion, a decrease in passive torque, as you can see in the figure on the left, and a decrease in the passive stiffness of the muscle and tendon unit. There's a possibility that these changes can be prevented if we include moderate to high intensity muscle contractions with the stretching program. However, it's not completely understood how the stretch-induced changes in tissue properties might affect muscle function during different active conditions. So our study aimed to investigate the acute effects of static stretching on the motor unit activity of the plantar flexor muscles. And secondarily, we wanted to determine whether maximal muscle contractions might attenuate the effects of static stretching. To do this, we used high-density electromyography, or EMG, on the right leg of our participants. We were recorded with 32 channel electrodes on the medial gastrocnemius, lateral gastrocnemius, and soleus. We had participants perform isometric plantar flexion contractions while we recorded the EMG of these plantar flexor muscles. Participants came to the lab on 2 occasions separated by 1 week. During one lab visit, they performed a maximal calf stretch for 4 times 30 seconds with 30 seconds rest. On the other day, they performed a control task for 30 seconds with 30 seconds rest. Before and after these interventions, participants performed some practice contractions, a set of maximal voluntary contractions to determine maximal calf strength, and these submaximal plantar flexion contractions where they ramped up their force, held it steady for 30 seconds, and then ramped it down slowly. And these were performed at both 10 and 35% of their maximum calf strength. After they did either their stretch or control intervention, we had them perform the 10% MVC submaximal plantar flexion task, followed by the 35% MVC plantar flexion task, a set of maximal voluntary contractions, and then those 2 submaximal contractions one final time. Importantly, all of the submaximal plantar flexion tasks were performed at the same absolute target torques, and these were based off of the very first set of maximal contractions, or MVCs. And it was during these submaximal plantar flexion tasks that we recorded high-density electromyography, or EMG. And this allows for the decomposition of the signals to identify the activity of individual motor units. In addition, we can use the cumulative activity of the sample of motor units as an estimate of neural drive, which you can think of as a highly sensitive indicator of muscle activation. And here we can see an example recording from one individual subject in the soleus muscle, where you can see the spiking of an individual motor unit fairly easily in the EMG recordings. We can decompose this signal using an algorithm to automatically identify the times of the action potentials, or spikes, from this motor unit, manually inspect them, and develop a spike train showing the motor unit's activity. An important part of analyzing motor unit activity in response to a treatment or intervention is knowing that the same motor units are being studied across multiple time points. So we can track these same motor units across all tasks of the same force level. And this is possible because we can identify individual motor units based on their electrical signature in the EMG grid. Also, this unique electrical signature of each motor unit allows us to record from up to tens of motor units at the same time. Here you can see one example motor unit with a very different signature across the grid than example motor unit number 2. But you can see how the shape is very similar across all 3 time points recorded. So let's take a look at an example of the motor unit activity we were able to record from one submaximal force task. During this 10% MVC submaximal force task, we were able to identify the activity of many motor units from the high density EMG signal. Each vertical line represents a single action potential, and each row represents the spike train, or activity across time, of an individual motor unit. So taking a look at the changes in motor unit activity averaged per muscle for each subject, we can first look at mean discharge rates, where there was a significant increase in mean discharge rate immediately after stretch, as you can see in the orange here. After the performance of maximal contractions with the calf muscles, mean discharge rates still remained elevated as compared to before stretch. Now, if we take a look at this increase immediately after stretch for each of the calf muscles individually, you can see that all 3 muscles show a consistent increase in mean discharge rates, with immediately after stretch shown in the lighter colors. To visualize this increase in motor unit activity, we can look at the response of one example participant. On the left, you can see the increase in discharge rates of individual motor units matched across time points, with their activity immediately after a stretch shown in the lighter green, blue, and gray. On the right, you can see the mean discharge rates for all the motor units tracked for this participant between both of these time points. In addition to discharge rates, another way to quantify the amount of required motor unit activity required to perform a given task is to determine when motor units are recruited. This is called recruitment threshold, and you can see here that we can identify when individual motor units are activated and at what force that this occurs. And we can do this for all the motor units recruited during the ramp up portion of the task. If we look at the mean recruitment thresholds for the 10% MVC task for all the motor units matched across the time points, we see a significant decrease in the recruitment threshold immediately after stretch, as shown in purple. And so this indicates that additional motor units were recruited at lower forces than before stretching, or they were recruited earlier. And interestingly, this change was reversed or attenuated after the performance of maximal contractions, as you can see in the pink bar on the far right. A summary of our 10% MVC results is that there was an increase in motor unit discharge rates across the contractions and a decrease in mean recruitment threshold force, or motor units were recruited earlier immediately after stretch. Interestingly, these changes were either partially or completely resolved after the maximal muscle contractions. Now, in regards to the 35% MVC task, we actually saw no influence of repeated static stretching on the motor unit discharge rates or recruitment thresholds. Our main conclusions are that stretching increased the amount of motor unit activity required to produce a given submaximal force. This implies that the stretch-induced changes in muscle and connective tissue properties result in less effective force transmission. However, this phenomenon was only observed at low force levels, such as 10% MVC. This is related to similar findings across different joint angles or muscle tendon unit lengths, where the largest changes in motor unit activity are also observed at low force levels. You can see this in the figure on the left with short and long muscle lengths of the tibialis anterior muscle tendon unit. So, whether induced by static stretching or changes in joint angle, the takeaway is that increased compliance of the muscle, tendon, and other connective tissues results in changes in neural drive at low force levels. And with that, I will pass it along to questions.